As many of you may know, we now have positive cases of the coronavirus tied to our community. I know this can create uncertainty, but we've been anticipating it and preparing for months for it. I want to talk about testing, which is the best tool that we have at the clinic to address the pandemic. We do two types of testing. We do exposure testing, where an individual that's had close contact with a positive case is tested, and we do surveillance testing. This is random testing where we're trying to find individuals with no symptoms or no known contact. This gives us the ability to react quickly and contain any potential outbreak. Many people want to know who gets tested and why. Unfortunately, we can't test everybody that asks. This is because we have to balance our current test supply with any potential long-term needs. Those who we do test are people who've had an exposure through close contact, people with symptoms, and we also do surveillance testing of people that are at high risk of exposure. This is like healthcare workers. When somebody's tested and they get their results, a negative test means you do not have an active virus at that time, but you still could contract it later. A positive test means that you have COVID-19 and need to coordinate with your healthcare provider or with us at the clinic for your care. Testing is designed for earlier intervention in slowing and stopping any spread of the disease, and intervention in treatment if someone is positive. Don't be afraid to test if your healthcare provider recommends it. Testing doesn't hurt, and we do rapid testing at the clinic. We'll get through this together by taking care of one another. This means washing our hands, wearing a face mask, and social distancing.